Okay, so Katie, what did you think of the course, the myofunctional therapy course that you went on in September?
It was amazing. I learned so much. A big thing that I learned was all about tongue position. I never knew how important the position of the tongue was in the mouth. So looking for things like a tongue tie, if there's a tongue thrust, if the patients tend to have their mouth open with their tongue on the floor of the mouth as opposed to on the roof of the mouth. It makes a really big difference to how you breathe. So I learned quite a lot, and it goes all the way back to even if a patient was breastfed or not. So when you breastfeed, it teaches the tongue to push the breast up, and you get a lot of strength in the tongue. So if you don't breastfeed or breastfeed incorrectly, not saying that you're doomed if you don't, but it teaches you not to have the tongue up on the roof of the mouth, and then you can end up having the tongue resting low. And if the tongue is resting low, the mouth is open, the face drops, and you get a forward posture, and then a whole lot of problems come about. So I know I just sort of rambled that off, but when I went to the course, there was just so many things that made sense, and it was so interesting. So it was a really fantastic course.
Hi, so just to let everybody know, what exactly is myofunctional therapy?
Good question, because I didn't know myself either. So myofunctional therapy is basically talking about all the oral facial muscles. So it's all about the muscles, so including your cheeks, your lips, especially your tongue, and how they work together for function.
So Katie, as a hygienist and therapist, how do you think this affects your treatment with children in particular?
It's changed a lot now, because back in the day we were taught like if children were grinding that it was just something they would grow out of and it was quite normal. But now we're finding signs that if they're grinding and they're snoring, then there's so many other things to look for. So if they can't breathe well through their nose and they're grinding and they're snoring, we look for, is there an airway issue? Do they have really large tonsils? Do they have really large adenoids? And the parents will report, yeah, you know, they get a lot of throat infections, they're not a well child. So we look for that, and first line I would send them off to the GP, maybe to the ENT, ear, nose and throat specialist, and just see, is there something we can do? And sometimes some kids will need some tonsils out or adenoids out, or they might have a nasal obstruction. And once that's cleared, parents come back and they're like, oh my God, my daughter or my son is sleeping through the night, they don't snore anymore, their behavior has changed, they're different at school. And so if we can pick that up when they're really young, we change their whole schooling. It's really rewarding.
Yeah, that's fantastic. That's really good.